Mr. Speaker, I rise today to speak on the shocking and disappointing state of the current approach to healthcare delivery and accessibility in Manitoba. The government's responsibility to implement the necessary preventative health and social services that promote positive and healthy development has not been realized in 14 years. Manitobans have a right to feel confident and safe when accessing medical services in our province. Our current Minister of Health was appointed 7 years ago this month, 3 years after Dorothy Madden died while awaiting care in one of our emergency rooms. There were already numerous reports available to the Minister by this time indicating that the situation in Manitoba's emergency rooms needed to be sorted out quickly. Yet 2 years later, Brian Sinclair was left to die in an emergency room while waiting a shockingly unacceptable amount of time for care. I've raised concerns on the prominent nutritional deficiencies in our population, such as vitamin D and long-chain omega-3 fatty acids. We not only have evidence that addressing these deficiencies, specifically in infants, would benefit several areas of health such as bones, teeth, cognitive development and behaviour, but also that it's not been accomplished in any impactful way under the current scattering of NDP programs. Nutritional deficiencies have not decreased in 14 years of this government's watch, and we now have twice as many Manitobans with diabetes as we did 14 years ago. The rate of diabetes in Manitoba continues to escalate. Studies have shown it's possible to reduce the incidence of diabetes by 60% for those at risk. This can be done through the implementation of effective measures, but we need a coordinated effort of community programs throughout the province to result in successful healthy outcomes. In response to these inefficiencies, we've heard 4 ministers, including the Premier, provide the excuse that they and their efforts are not perfect, 8 times in the House since Thursday. Not perfect is not a phrase Manitobans ever want to hear when their loved ones die while waiting for care in our emergency rooms. Manitobans have no confidence in the Minister of Health, and it's time for her to resign and for the Premier to find an effective replacement who can get our health care on track.